For today's video, we're going to do some soft tissue work with the tennis ball. I'm going to start in my upper back and work my way down. So for this, all you need is a tennis ball, a lacrosse ball, or one of those massage balls that you can get at Academy or Dick's Sporting Goods or Walmart. And I'm going to take my implement and put it just under my trap here. So kind of like when your shoulders get tight, you squeeze your traps, we're really just looking for that muscle. And I'm going to kind of put this tennis ball right underneath this guy and put some pressure on him. Shouldn't be painful, it should feel kind of like a deep tissue massage. And here, I'm going to reach my hand overhead. I'm going to go thumb down and reach my hand down. I might rotate my arm here. I'm just going to work up and down through this side for a minute. I bring my arm around to the side, kind of windshield wiper this way. And we're just really looking for any tender spots in that muscle and trying to expose those tender spots to pressure until they melt away. I'm going to move this down a little bit between my shoulder blade and my upper back. So I've got that there. I'm going to reach my arm overhead again. Bring my elbow down towards my side, almost like I'm doing a pull down or an overhand chin up type position here. And you should feel some muscle tissue in your upper back. I know I've often got a knot kind of between my shoulder blade and my spine. And you can kind of hunt around in this area. You may move down or up to find where those spots are. And we're just working through them. Maybe take your arm across your body here, back out to the side, up towards the ceiling, all the way back down. And we'll move it a little bit lower here and get my mid-back position. We're just gonna flex through that same thing here. We can bring our arm up and down. We may even start to wanna sit up, kind of flex and extend over this pressure. You can work your way all the way down your spinal erectors. And then here, I'm gonna place this in my QL, so you'll feel your spine and then your iliac crest back here. So that's that hard kind of arc of your pelvis. You'll feel this fan type shape, and then you'll feel your spine. And in between there, we've got a muscle called our QL. Low back muscle can get kind of tight. So I'm gonna put that tennis ball right in my QL. I'm gonna kind of support and roll over towards that side. And bring this leg up and out, in and down, up and out, in and down. May even flex my knee towards my chest some, or may roll more over onto our kind of back facing the ceiling. And here I can kind of roll my hips and flex in and out over that pressure. So we're really just looking for any type of positioning or rolling activity that massages that muscle tissue in a way that feels relieving to you. After this, I'm gonna move on to my glutes. So I'm gonna sit up and come into a hand supported position. And again, we've got that iliac crest, that fan shape of our hip. I'm gonna put my tennis ball right in that posterior hip, hand support behind me. And then again, I can bring my knee up and over, in and out, up to the side. I may even pick my leg up and down like this. And again, looking for any tender spots in those glutes and hips. Just working our way through that material. Might try redistributing your weight to your elbow or sitting up even higher, depending on what feels best to you. After I've worked through this, I'm gonna go ahead and roll over here. Work through my quad just a little bit. So here, you can almost take this tennis ball and find a sore spot kind of right in the middle of my thigh, maybe higher up in your hip flexor. So you can hunt around for anywhere in this region that feels tight. Sometimes our tennis ball will want to shoot off to the side. If you feel like that's going to happen, you can always take your hand and place it around the tennis ball so it doesn't move. From here, I'm going to flex and extend my quad, drawing my heel towards my butt, extending my leg back towards the floor. Just trying to put that tennis ball pressure into some of those sore spots. And we're applying that pressure and then gliding all these layers of tissue over that pressure, just trying to help ourselves get a little more mobile here. You may hunt around a little bit lower in your thigh. Again, applying that pressure where it feels best, flexing and extending, waiting for that muscle tissue to relax, working through any sore spots. From here, I can work my way up to my pectoral muscle. So I'm gonna put my arm out to the side and I'm really just gonna place this right in my pec, right in that kind of breast muscle tissue here. And then I can lay it with my head facing either side, whichever feels best to you. I'm gonna take my hand, point my thumb down to the ground, maybe contract my palm into the floor, feel that muscle flex into the pressure, and then relax. You can take your opposite hand and roll yourself up onto this and do a fan motion here. Maybe bring your elbow up and back out, Really just working on feeling some of that pectoral muscle tissue release. We can work down our arm and do the same thing in our bicep region. I can point my thumb down. I can roll that pressure over that bicep tissue here. Similarly, I could roll onto my back. I could flex and extend over that tricep tissue. Last but not least, certainly you could sit up in a chair with this pressure on your hamstring and flex and extend your leg like you're doing a hamstring curl. Or here, I can take this tennis ball, put it in my calf, even apply a little more pressure with my opposite leg, and then pump my foot, and we'll feel some of those tender bits in our calf start to melt as we flex and extend over that pressure on that sore spot. Again, if anything is painful or uncomfortable, go ahead and back off. We're not trying to compress any lymph nodes or any blood vessels, nothing important or anything that we could damage. Really just looking for a kind of good massage feeling, gentle pressure, and you don't have to go harder than feels comfortable or helpful for you.